if any of you is less energetic and foggy-headed, it implicates you are hypoxic. This lecture tells you all the possible causes. Hypoxia means your body cells in short supply of oxygen. If you want to be energetic and clear-headed for the whole lifetime, this lecture tells you the comprehensive solution, possibly most inclusive in the world. This lecture also calls for attention on the fact that there are a couple of factors neglected in oxygen supply chain, especially clinically. This lecture not only introduces novel ways to improve oxygen delivery to the tissue cells of the body, but also focuses on hypoxia, the causes of hypoxia, the solution to hypoxia, and hypoxia as a common cause of a variety of presently prevalent chronic diseases. This lecture consists of sections as follows. At the first section, I will point out what factors in oxygen supply chain are neglected as revelation for the reason why you are less energetic and foggy-headed. For example, the final step of circulation, which is oxygen release to the tissue cells across the body, is mostly neglected. After all, oxygen is only useful after released to tissue cells. If you ever thought of the reason why the elderly adults are generally less energetic, which implicates that their body is incapable of acquiring enough oxygen to produce enough energy. Why is that? You may say the elderly adult carries less amount of oxygen in their blood. Wrong. As long as you are anemia-free, your blood carries sufficient amount of oxygen, just like youngsters do. So why most elderly adults who are not anemia still can't acquire enough oxygen to be energetic? Obviously, the answer is that oxygen in the blood is not fully released to the tissue cells. Significant amount of oxygen still stays in the blood, unable to be released. The step of oxygen release is very vulnerable. For example, you are energetic in the morning and fatigued in the evening. That's exactly due to decreased efficiency in the step of oxygen release. However, clinically, doctors generally pay attention only to common anemia, almost totally neglecting the step of oxygen release. The elderly adults are obviously suffering from hypoxia, but there is nothing of effective treatment that helps recover better health condition by effectively eliminating their hypoxia. Think about it. Once the elderly adults regain the ability to be energetic by improving all the factors influencing oxygen supply, surely they won't be frail anymore. And are they going to still suffer from variety of any chronic diseases any longer? Just think about it. At the second section, I will elaborate on microcirculation disturbance, analyzing the cause of a formation and suggesting a solution. Microcirculation disturbance, which is almost not dealt with clinically, is due to partial obstruction in any of the arterioles. At the end of this section, we reach a conclusion that hypoxia is widely permeated in modern human life. At the sections followed thereafter, I will discuss the intrinsic connections between hypoxia and a variety of health problems or chronic diseases, such as malaise, pain symptoms, hypertension, obesity, diabetes, brain problems, kidney malfunction, liver malfunction, immunity, and insomnia. After all, oxygen is fundamental to all the biological activities of almost every cell in our body. Therefore, hypoxia must bring up various health problems across the body. As a reminder, you may have found that anyone who is energetic, which means free of hypoxia, seldom suffers from any chronic diseases. On the contrary, anyone who is less energetic, which means hypoxic, is very susceptible to falling variety of chronic diseases. Typical example is the elderly population. On the basis of my observations in the past 11 years, I propose that most of the prevalent chronic diseases are essentially caused by hypoxia. By the way, so far, most chronic diseases are unknown of any causes. That's why they are incurable. Think about it. If the cause is not traumatic, not chemical damage, not microbial agent, not genetic, then what else? Can it be the hypoxia, which coincidentally was widely neglected? Now, I will give two brief examples to show you the obvious connection between hypoxia and chronic diseases, and make more detailed discussions later in the sections followed thereafter. First, hypoxia on obesity and diabetes mellitus. Obesity and diabetes arise from the abnormalities in sugar regulation. The nature of sugar is of fuel, burning itself to provide energy to our body. Given its nature as a fuel, sugar regulation must be deeply impacted by hypoxia. That is self-evident. Absolutely no need for any evidence at all. But the reality is, to my best knowledge, in worldwide clinically, no doctors treat obesity and diabetes in light of hypoxia. Isn't that ridiculous? Second, hypoxia on pain symptoms. Under hypoxia, cells are not able to produce sufficient amount of energy, which induces elevated osmotic pressure inside the cell. High osmotic pressure drags in water molecules from the outside in, and as a result, the cells grow in volume, which is called edema. When the volume of the cell grows enough to touch the adjacent pain nerve ending, you feel the pain symptom. So most of the pain symptoms are caused by hypoxia. Thirdly, I will discuss other presently prevalent chronic diseases in light of hypoxia, of course. The subject of cancer is not covered in this lecture, but obviously maintaining free of hypoxia is one of the most effective anti-cancer means because hypoxia is a feature of all solid tumors, contributing to tumor progression and therapy resistance. Upon grasping my explanation to the close connection between hypoxia and various chronic diseases, it must occur to everyone that eliminating hypoxia is presumably the master key to most of the prevalent chronic diseases. However, neither oxygen inhalation nor hyperbaric oxygen chamber treatment can eliminate the hypoxia, since this hypoxia we are talking about is caused by poor quality of blood or microcirculation disturbance, other than oxygen content of the blood. By blood, I mean red blood cell, or RBC, in short, because RBC is responsible for close to 100% of oxygen supply to tissue cells. By the way, throughout this lecture, I will use the term RBC instead of a red blood cell for the sake of convenience. And I coined the method of eliminating hypoxia by comprehensively improving RBC quality as OTEC, standing for oxygen therapy by improving erythrocyte quality. Erythrocyte is a medical term for RBC. The efficacy of OTEC is amazing. Improvement of RBC quality brings about markedly improvement in oxygen delivery to every tissue cells across the body. Accordingly, all the abnormalities caused by hypoxia get a benefit and naturally embark on self-repairment. In my opinion, our body is intrinsically equipped with strong capabilities of self-repairment. All it needs is sufficient supply of oxygen and the whole spectrum of nutrition uptake. I accumulated tons of feedbacks from the benefited people over past 11 years. If you are interested, you may visit my website here, domain of which bears my name in Chinese pronunciation, zhuchengtai.net. As I said, present clinical practice almost totally neglected the step of oxygen release and microcirculation disturbance, which implicates there are numerous incidents of hypoxia untreated clinically, no matter the degree of hypoxia severity. Naturally, any abnormalities caused by these neglected types of hypoxia are impossible to be cured because the cause is neglected. That explains the reason why the incidences of chronic diseases grow in number year by year like unchallengeable deluge. The trend just doesn't cave in at all. Now, let's move on to see why the hypoxia is permeated in modern human life. In overview, the blood takes up oxygen in the lungs, transports it through circulation system, and upon arriving in vicinity of the tissue cells, releases the oxygen. This is the whole cycle of the mission. In micro view, oxygen is released only while the RBCs are inside the capillary vessels. This restraint is very important. Always keep it in mind. Therefore, to maximize oxygen supply, you have to drive more and more fully oxygenated RBCs into capillaries. The more RBCs are passing through the capillary every moment, the more oxygen is having chance to be released. To achieve this objective, let's see how many ammunitions are available. First, the vasculature, or blood vessels, which decides the amount of blood flow passing by the tissues. When a small artery reaches an organ, it branches off into numerous smaller vessels called arterioles. The volume of blood flowing through an organ can be regulated by adjusting the diameter of these arterioles. Arterioles branch further within the organs into capillaries, only inside which RBCs release oxygen. More blood flow means more RBCs having chance to enter the capillary. Generally, blood vessel has much redundancy in its capacity. However, when vasculature integrity is compromised, as in thrombosis, multiple sclerosis in the artery wall, or microcirculation disturbance in arterioles, the blood flow to a specific tissue can be in shortage. Microcirculation disturbance is most commonly arising problems causing regional hypoxia and accordingly the regional diseases. For example, most pain symptoms, most brain problems, nephritis, and so on. However, in clinical practice, microcirculation disturbance is less paid off attention, or in many cases, even neglected. I will elaborate the formation, cause of, and the solution to the microcirculation disturbance at the next section. Second, blood oxygenation, which means RBCs taking up oxygen at the lungs. Surely, the more oxygen the blood carries, the more oxygen is available for release in capillaries. Two factors are in work: RBC count and the hemoglobin concentration. Lower than normal range of RBC count is called anemia. And the other, hemoglobin, which resides inside the RBC, responsible for capturing and holding the oxygen. Obviously, the more hemoglobin inside each RBC, the more oxygen is captured and held. Iron deficiency causes shortage in hemoglobin synthesis, resulting in iron deficiency anemia. To sum up, as long as you are free of these two types of anemia, your blood surely carries enough oxygen. It is sure that the higher the hemoglobin concentration and the higher the RBC count in each unit of blood flowing the arterioles, the more of oxygen is likely to enter the capillary for release. And the third, oxygen release. This step is mostly neglected, both in everyone's daily life and clinically. So far, doctors seem to take it for granted that as long as your blood carries a sufficient amount of oxygen, you are supposed to be free of hypoxia. Obviously, that idea is wrong because most elderly adults are hypoxic, but their blood generally carries sufficient amount of oxygen, given the fact that most of them are anemia-free. What makes doctors think that way is the fact that they almost totally neglected the step of oxygen release, as if this step is never out of whack. The step of oxygen release is very volatile, and there is plenty of room for improvement for almost everyone, no matter young or old, so as to markedly boost oxygen delivery for most people, especially most of those who are less energetic. For example, the elder adults. The step of oxygen release is so important that most modern diseases are rooted in it, according to my observations in the past 11 years. Okay, let's zoom in to see how this step works. Three factors work in concert. First, and the most vulnerable factor, the flexibility of RBC. I'm sure most likely none of you ever heard of this term before. So what is RBC flexibility? I told you a few minutes ago that oxygen is released only while RBCs are inside the capillary vessels. The problem is the inner diameter of the capillaries, about 4 to 6 micrometer, is smaller than the size of RBCs, which is 7 to 8 micrometers. How can you make larger RBCs get inside the smaller lumen of a capillary? That is exactly where RBC flexibility comes into play. Normal RBCs can be flexible enough to be fully deformed and squeezed into the capillary. That's very like a fully deflated balloon, which can be deformed to any form, any size. Just like this. This balloon is like a RBC, far bigger in size than this tube, which represents the capillary vessel. See, with a full deformation, the balloon is readily able to enter this tube and pass through it. By the same mechanism, even though larger, RBCs are able to enter and pass the capillary. Problem is, what if the RBC is less flexible or rigid? And in fact, they are rather volatile in flexibility or rigidity. The rigid RBCs have small chance to enter the capillary. Without entering the capillary, there is no chance at all to release oxygen because RBCs release oxygen only while they are inside the capillary. No better choice, most of these rigid RBCs have to flow directly to the venule and get back to the heart with oxygen unreleased at all. That is like a fully loaded trucks arriving at the destination and without unloading any cargo, simply returning to the starting point. Obviously, that is a tremendous waste of kinetic energy created by the heart and a waste of a condensed resource of vasculature. Even worse, these rigid RBCs keep flowing in the circulation system without rest, rarely having chance to unload the oxygen they carry. With these rigid RBCs not releasing the oxygen, the blood can be high in oxygen carrying capacity, but low in oxygen delivery capacity. The more number of rigid RBCs are there, the lower the efficiency of oxygen delivery by the blood. For example, say there are 10 cc of blood passing a capillary bed in a given moment. It is possible that, say, 80% of the total RBCs in the blood flow enters capillary for oxygen release. On the contrary, with a vast number of rigid RBCs in blood, it is possible that, say, only 60% of total RBCs in the blood flow enters the capillary. I mean, the parameter of RBC flexibility can cause significant hypoxia. You can easily appreciate its detrimental effect by comparing the elderly adult population and the youngsters. Their key distinction stems exactly from their difference in average flexibility of RBCs. And there is another scenario in which these rigid RBCs enter the capillary by chance, but they will make the capillary slightly bulged up, creating strong friction with the capillary wall, which obviously impedes the movement of these RBCs, which means they take longer than normal length of time passing through the capillary. Consequently, even the normal RBCs flowing behind them have to keep the same slow pace passing through the capillary. As a result, the number of RBCs entering the capillary per minute is decreased. Therefore, the amount of oxygen released per minute decreased as well, which virtually brings about hypoxia. Imagine you have a large number of rigid RBCs in your blood. Your blood becomes very inefficient in releasing oxygen to tissues across your body. And you become bodily hypoxic, even if your blood carries sufficient amount of oxygen. This is exactly why the elderly adults are generally less energetic. Exactly, their blood is higher in the number of rigid RBCs than youngsters. Next, let's see what factors cause RBC rigid. Overnutrition, stress, and aging all contribute to the impairment of RBC flexibility. Overnutrition includes high level sugar and a high fat level. Yes, high level of sugar and high level of fat cause hypoxia by impairing RBC flexibility. And in turn, hypoxia causes variety of health problems. That's why you see the complications of diabetes, and that's why you can observe the correction of a high level of fat brings about comprehensive health improvement. Aging is accompanied by variety of chronic diseases as well, which is also due to hypoxia caused by principally by impaired RBC flexibility. Stress and hypoxia promote production of free radicals, which impair RBC flexibility as well. Stress is also responsible for formation of a microcirculation disturbance, which will be elaborated later. It is a kind of a consensus that overnutrition, stress, and aging are closely related with most chronic diseases. Coincidentally, all these three factors impair RBC flexibility. Now, you should realize the problem of impaired RBC flexibility is widespread. Accordingly, hypoxia is permeated in modern human life. Don't forget, hypoxia causes variety of health problems because oxygen is fundamental to all the biological activities of almost every cell. We can better understand the hypoxia causing overall health problems by observing those with anemia or those who freshly come to high altitude. The list of health problems caused by these two scenarios is very long. That surely includes all those prevalent chronic diseases. However, in clinical practice, there seems no any idea or intentional effort made in treating hypoxia caused by impaired flexibility of RBCs. In other words, RBC flexibility has been totally neglected clinically, to my best knowledge. Weird enough, though, there are a huge number of research papers available regarding RBC flexibility. You can find the related papers by searching keywords like RBC flexibility, RBC rigidity, or RBC deformability in the scholar site of Google. In other words, in laboratory, the importance of RBC flexibility has been established, while in clinical practice, it remains neglected. Next, we move on to the second factor affecting the step of oxygen release, RBC diameter. Under deficiency of either vitamin B12 or folic acid, the diameter of RBC is abnormally large upon their maturation, called macrocytes, more than 10 micrometer, at least 25% larger than normal RBCs, which are 7 to 8 micrometer only. With macrocytes, the similar problem occurs as in impaired flexibility of RBCs. The reason is obvious. Inner diameter of a capillary is too small in comparison with macrocytes. Therefore, when the number of macrocytes climbs to a certain extent, the oxygen delivery efficiency of the blood is so severely compromised that it is called pernicious anemia in medical terms. The last factor in work at the step of oxygen release is a carbonic anhydrase, which resides inside the RBC, just like a hemoglobin. Oxygen is of a gas, therefore, in factory or in hospital, it is compressed in air-proof tanks. And to release the oxygen, you have to turn the air valve of the tank. Similarly, hemoglobin is like the oxygen tank. It captures and holds the oxygen molecules. And the carbonic anhydrase is like the air valve, which can turn on hemoglobin to release oxygen, while RBCs are inside the capillary. The subject on how carbonic anhydrase works is saved in this lecture. But you should remember one thing, that the metal element zinc is essential for the proper functioning of a carbonic anhydrase. To sum up, to maximize oxygen delivery efficiency of blood, there are at least 5 factors to be optimized. And they are all about RBCs, such as RBC count, hemoglobin concentration, which resides inside RBC, RBC flexibility, RBC diameter, and lastly, carbonic anhydrase, which also resides inside RBCs. As long as you are less energetic or planning to be fully energetic, no matter young or old, you should optimize all these 5 factors. Based on my observations in the past 11 years, I summarized the following 5 points which must be helpful to improve oxygen delivery efficiency of the blood for anyone. First, to have optimum RBC count, I suggest put vinegar into your regular dietary by any means. Vinegar presumably improves the efficiency of various enzymes by means of acetylation, including those enzymes involved in proliferation of RBCs. For your information, metabolite of alcohol is acetic acid, which is the essential ingredient of vinegar. Therefore, appropriate drinking alcohol regularly is good for maintaining optimum RBC count. Second, to have a sufficient concentration of hemoglobin, you should regularly take foods high in iron. For example, red meat, cloud air fungus, and so on. Third, to maintain the best flexibility of RBC, I recommend a soft gel product codenamed X Soft Gel, true name of which is hidden for the sake of eliminating commercial smell. I have personally taken this X Soft Gel for 11 years, and all my pioneering work on hypoxia is based on my observations on users of X Soft Gel. Drinking tea is also helpful to RBC flexibility, but far behind X Soft Gel. Full rest and good sleeping are also required for good flexibility of RBCs. Keep it in mind, the flexibility of RBC worsens with aging if no proper maintenance is given. Fourth, to have a normal size of RBCs, you should regularly take whole spectrum of nutrition required by RBC development, including folic acid, vitamin B12, among other vitamins. If all foods are heated during preparation, one is likely to be deficient of folic acid, which is extremely vulnerable to heat. For vitamin B12, meat, beans, and nuts are helpful. If you have a gastrointestinal issue, you may have to take special care of a vitamin B12 supplement. Fifth, to have a sufficient amount of carbonic anhydrase, regular uptake of foods high in zinc is important. If you have gastrointestinal issue, you may have to take special care of a zinc supplement. The method above is called OTEC, standing for oxygen therapy by improving erythrocyte quality, which is quite comprehensive and effective, possibly most inclusive in the world. You may have noticed that all 5 factors can be properly maintained by proper dietary and lifestyle, unless you have a gastrointestinal issue. That's why I think dietary habit is most important for anyone's health. And throughout this lecture, when I mention about RBC quality, it refers to all 5 factors above. When RBC quality is in optimum state, least blood flow is required to easily deliver oxygen as much as needed by the tissue cells. Less blood flow requirement means bigger redundancy in vasculature. For example, if a metabolism rate suddenly surges to an extreme high in specific tissue, with the best RBC quality, the circulation system can meet the peak oxygen demand without dilating the arterioles to their upper limits. On the contrary, if RBC is inferior in quality, it cannot meet the peak oxygen demand of the tissue, even if dilate the arterioles to their upper limits. Okay, now we think about this scenario. What if metabolism rate suddenly rises to an extreme, like emotional trauma, which requires a peak amount of oxygen supply, and the arterioles are dilated to its upper limit, and the maximum amount of blood flow possible is drawn in, yet still unable to meet the oxygen demand of the tissue? What's going to happen? It brings us the issue of a microcirculation disturbance. Let's move on. Simply speaking, the abnormally narrowing of an arteriole is called microcirculation disturbance. On basis of my observations in the past 11 years, I propose that the most common microcirculation disturbance is caused by hypoxia of endothelium of arterioles. Let me peel the onion layer by layer. First, what is endothelium? The innermost lining of any vessel, including arterioles, consists of a special type of cells aligned neatly shoulder to shoulder, constituting the lining of all vessels. These cells are called endothelial cells. Under hypoxia, most cells, including the endothelial cells, grow in size called edema. Edema is resulted from too many water molecules entering a cell. Under hypoxia, a cell is unable to produce enough energy, which induces high osmotic pressure, which in turn drags the water molecules from outside into the cell. The result is edema, the size of the cell enlarged. I've just told you the endothelium cells constitute the lining of all types of blood vessels. Imagine it. When the innermost located endothelial cells grow in size as a result of edema, they have to bulge up to the center of the vessel, making the vessel partially obstructed, narrowing the diameter, which is exactly microcirculation disturbance in case arteriole is involved. So the question now is, what can make endothelial cells hypoxic? To answer that question, you should know first how endothelial cells get oxygen. Take a look at this diagram. This is an arteriole, this is a tissue cells, which are merely representative of numerous tissue cells indeed. This pair are nerve endings. This is a capillary bed, and this is a thoroughfare. By the way, most rigid RBCs without releasing oxygen flow directly to the venule through this thoroughfare. The innermost lining of this arteriole consists of endothelial cells, and all of them are immersed in the fluid called interstitial fluid. As I mentioned, RBCs release oxygen only while they are inside these capillaries. Therefore, even though RBCs pass by the endothelial cells of arterioles every moment, they can't release oxygen directly to the endothelial cells. Now turn to capillary. The released oxygen molecules cross the capillary wall and diffuse to interstitial fluid, from which both tissue cells and the endothelial cells of arterioles acquire the oxygen. Your attention here, the both are competing for oxygen on the same interstitial fluid. Think about it. In case tissue cells consume too much of oxygen, say more than the capacity of the circulation, then the interstitial fluid would be depleted of oxygen. As a result, both the endothelial cells and the tissue cells all fall in hypoxia, which of course causes edema for both. And as explained a minute ago, the edema of endothelial cells results in microcirculation disturbance. And the edema of tissue cells, by growing size to touch the adjacent nerve endings, may induce various symptoms, depending on the specific type of the nerve. Here, we have 2 points that need more discussion. 1. On what circumstances tissue cells consume too much oxygen? In fact, there are many. For example, emotional and psychological trauma, unrelenting physical exhaustion, too much sex, overload of stress, and any other hyperactivity. All these incidents are accompanied by overconsumption of oxygen. Second, on what circumstances oxygen delivery capacity of the blood can keep up with the upsurging oxygen consumption by the tissue cells? The answer is when RBC quality is not good enough, or in other words, when oxygen delivery efficiency of the blood is not good enough, which requires large amount of blood flow to deliver minor amount of oxygen. Consequently, even with the arterioles dilated to their upper limits and the momentary highest blood pressure available to maximize blood flow, the circulation still can't keep up with the upsurging oxygen demand of the tissues. And the result is hypoxia of the endothelial cells of the arterioles, which is exactly microcirculation disturbance. This also explains why those who are less energetic is susceptible to variety of chronic diseases, because they have inferior RBC quality and easy to form microcirculation disturbance. On the contrary, since those who are energetic have good quality RBCs, they seldom fall into microcirculation disturbance. Now, you should realize how important the RBC quality is to health. Recall the 5 factors that decide the oxygen delivery efficiency of the blood. Among them, RBC flexibility is most vulnerable, which can be impaired by lasting stress. So lasting stress plus sudden overload of stress is enough to create microcirculation disturbance. So, is there any solution to microcirculation disturbance? As just explained, microcirculation disturbance is caused by the edema of endothelial cells, which in turn is caused by hypoxia. Therefore, the root cause is hypoxia. So solution is simple, that is to deliver more oxygen to the region in problem. And things evolve the way exactly opposite of the formation of a process of a microcirculation disturbance. So question is how to deliver more oxygen? There are 3 options. 1, the method I coined OTEC, improving the RBC quality for the purpose of increasing oxygen delivery efficiency of the blood, which means with the amount of blood flow unchanged, more oxygen can be released. Second, utilizing the agent that is able to dilate the blood vessel, For example, ginkgo leaf extract. 3. Oxygen inhalation or hyperbaric oxygen chamber treatment. Based on my observations in the past 11 years, the first option and the second option together usually do the work good enough. Importantly, for OTEC here, the serving size of X-soft gel, which is responsible for improving RBC flexibility, should be significantly increased. To be specific, 6 times the usual serving size. Okay, I think most of you now believe that hypoxia is widespread, caused either by poor RBC quality or by microcirculation disturbance, permeated in modern life of anyone. This conclusion is very important because in the past, you might not have considered this type of hypoxia as cause for any abnormalities, but now you have to. The existence of hypoxia is, according to my observation, the root cause of many types of diseases, especially in most chronic diseases, such as malaise, most brain diseases, obesity, diabetes, hypertension, pain symptoms, most kidney malfunctions, liver malfunctions, insomnia, etc. The curious part is all these chronic diseases are so far unknown of causes. To these chronic diseases, the present mainstream formalities taken by doctors are, instead of treating the causes, mostly treating the symptoms to temporarily relieve patients of symptoms because the cause is unknown. In my opinion, that's because clinically hypoxia was widely neglected. What if we first consider hypoxia as a common culprit for them and see if they can be cured by improving oxygen delivery efficiency of the blood? In fact, my observations on X-soft gel users in the past 11 years tells exactly hypoxia underlies as the common cause of most chronic diseases, not limited to those I just mentioned. And I embarked on the quest for uncovering the connection between hypoxia and a variety of chronic diseases. So next, I'd like to share my view in light of hypoxia on those chronic diseases. To help more audiences to comprehend with ease, I'd use plain language as much as possible. Now, let's move on to see how hypoxia brings in overall detriment to our body. Malaise, also called suboptimum health, is a feeling of general discomfort, uneasiness, or pain, of being out of sorts. Malaise expresses a patient's uneasiness that something is not right, but it is hard to find out the cause, even with routine medical examinations. Think about it. If you have quality RBCs and your body is able to acquire the oxygen with ease as much as needed, the result is that you enjoy the state of being energetic, clear-headed, and comfortable. As a result, malaise is surely gone on its own. Therefore, in my opinion, malaise is simply caused by mild hypoxia, which in turn is caused by inferior RBC qualities neglected clinically. Most likely the flexibility of RBC. And the X-soft gel is by design especially good for recovering and improving the flexibility of RBCs. Okay, this much for malaise. And let's move on to the next section, hypoxia on pain. Pain symptoms are result of a stimulation of pain nerves. As I told you, while in hypoxia, cells grow in size, called edema, When edema grows enough to touch the adjacent pain nerve, the nerve is stimulated and you feel the pain symptoms. Meanwhile, there is a literature asserting lactic acid may cause pain symptoms as well. Coincidentally, lactic acid is a major metabolite of sugar under hypoxia. In any case, eliminating the hypoxia presumably cures many pain symptoms. It is different in nature from the painkiller pill, which merely relieves the pain symptoms temporarily. To eliminate the hypoxia, the first job is to improve RBC quality, the method I have explained in previous sections by the name of OTEC. If a microcirculation disturbance is out there, in addition, you have to utilize the vasodilating agents like ginkgo leaf extract. Attention, the serving size of X-Soft-Zel, which is responsible for improving RBC flexibility, should be significantly increased while treating microcirculation disturbance. To be specific, 6 times the usual serving size. As I observed in the past, this method is very effective, but one point must be emphasized. Under hypoxia, original form of tissues change by the form of edema at the beginning. If oxygen delivery is increased by means of improving RBC quality, the edema disappears. In a sense, the tissues recover from enlarged size to original size. In other words, tissues live away from the adjacent nerve endings, and the symptoms disappear accordingly. This is, in effect, a cure. However, under long-term hypoxia, tissues, instead of enlargement as in edema, it shrinks. If oxygen delivery is increased, the tissues recover because of intrinsic self-repairing capability. Tissues recover in their size as well, from shrunken size to original size, which is in a sense enlargement of the tissue, inevitably pushing away the adjacent nerve endings in the path, so as to touch off pain symptoms. This is called healing crisis. This phenomenon is applicable to many chronic diseases that have anything to do with the shrunken tissues, not restricted only to pain symptoms. Mind you, recovery of some long-term chronic diseases is inevitably preceded by the recovery of shrunken forms of tissues, which induces temporary symptoms called healing crisis. Okay, let's move on to the next section, hypoxia on hypertension. Blood pressure is decided by cardiac output times total peripheral resistance, where peripheral means everything in our body except the brain. When the vessel constricts, the peripheral resistance climbs up. Under stress of oxygen supply, it is a general rule that vessels leading to the brain dilate, while vessels leading to the peripheral constrict. That's because brain is so much susceptible to hypoxia that our body is designed to utilize all means to drive sufficient blood flow to the brain so as to keep the brain from hypoxia. And this engineering design is to bring about hypertension in time of a tight oxygen supply situation. Normally, a tissue can get increment of oxygen supply by drawing in more blood flow by means of dilating the arterioles that supply it. But in case the dilation to the arterioles upper limit is still not able to meet the demand of tissue cells' oxygen requirement. There is only one means still available, that is to increase cardiac output, which surely results in elevation of blood pressure. Take a look at this diagram. Now assume a regional tissue of the brain is thirsty for oxygen at a given moment. How to deal with this situation? In hindbrain, there is a brain tissue called medulla oblongata, which is a cardiovascular center able to control both cardiac output and the diameters of peripheral vessels, either directly or indirectly. In case it receives a request from a brain tissue for more blood flow or more oxygen supply, medulla oblongata responds by instructing the heart to increase cardiac output, meanwhile constricting the peripheral vessels, which causes peripheral resistance climbing up. As a result, the blood pressure climbs some degree. See this equation here, increase of peripheral resistance and an increase in cardiac output, resulting in elevation in blood pressure. And the blood flow to brain is driven up in whole, and the region that just called for help gets the increment of blood flow, which amounts to more oxygen supply. In this scenario, blood pressure climbs a certain degree, not necessarily high enough to make incidence of hypertension. But by this mechanism, it is possible for formation of a hypertension depending on such factors as the magnitude of oxygen deficit of the tissue in the moment, oxygen delivery efficiency of the blood, or whether there is a microcirculation disturbance or not. First, when RBC quality is poor enough, blood is very inefficient in delivering oxygen, which means to deliver normal amount of oxygen, it requires a far more than normal quantity of blood flow. Therefore, without a hypertension inducing big quantity of cardiac output, it is not possible to meet the oxygen demand of the brain. And sustained hypertension can be formed. See, the mechanism of hypertension is very simple. The cause in this case is simply RBC quality poor enough. This type of hypertension is supposedly accompanied with a high cerebral blood flow because poor RBC quality requires a high blood flow for all the brain tissues. The solution is to improve RBC quality, which is not too difficult to achieve. You may look up the method OTEC described in the previous section. Hypoxia caused by poor RBC quality influences the whole body, not restricted to brain tissues. The severe bodily hypoxia causes various diseases, most prominently obesity, which I will explain in next section. So this type of hypertension is not only high in blood pressure, but also obese. Second, when the momentary oxygen consumption by a brain tissue is too high, or big magnitude of oxygen deficit, as in overload of mental stress or emotional trauma, the blood, even with moderate RBC quality, is not good enough to deliver sufficient oxygen to the tissues, even dilating the arterioles to upper limits, and at the expense of a momentary highest possible blood pressure. The result is hypoxia of endothelium of the arterioles in the questioned region, which forms microcirculation disturbance, as I explained in previous section. When a microcirculation disturbance is permanently formed, it is hard to supply normal amount of blood flow passing through the already narrowed vessel, even under hypertension, and the permanent hypertension is formed consequently. Hyperactivity of any tissue, including the brain, requires oxygen overconsumption, which is a primary cause for the formation of a microcirculation disturbance. Hyperactivity can be interpreted as excessive stress. This is in line with the widely acknowledged observations that intensive stress may induce hypertension. In the scenario of a microcirculation disturbance, RBC quality may be in moderately good state, which means there is no bodily hypoxia. Accordingly, neither the obesity. By the way, the brain tissues with good integrity of arterioles constrict their arterioles to prevent overperfusion of blood flow under hypertension. Therefore, with this type of hypertension, the increase in total cerebral blood flow is supposedly insignificant. Thirdly, keep it in mind that not all the brain tissues in hypoxia are by design able to make requests to medulla oblongata to increase blood flow. For example, some cerebral thrombosis patients are normal with blood pressure. Cerebral thrombosis means blockade of a certain brain vessel by thrombus, downstream of which is obviously in hypoxia, that actually made various symptoms for thrombosis patients, but still maintaining a normal blood pressure. It is worth to point out, one, that hypertension is adaptation of the body to barely meet the brain's oxygen requirement. Second, the two types of hypertension I just explained have so far been neglected medically. Why in the world the present clinical practice have not found the types of hypertension walking these pathways? The answer is because clinical practice neglected these types of hypoxia caused by either poor RBC quality or microcirculation disturbance. Accordingly, to my observations in the past 11 years, hypertension, as described above, truly exists, and the population is probably vast, given the fact that people with a poor quality RBC or microcirculation disturbance are significant in number. And I believe these types of hypertension very likely coincide with the so-called primary hypertension, which so far is unknown of its cause. For more information, you may visit my website here, zhuchengtai.net. Next, let's move on to the next section, hypoxia on obesity and diabetes mellitus, which is a quite big subject. Obesity and diabetes are also called metabolic syndrome due to disorder in sugar metabolism. Sugar is also called glucose. I will use these two terms interchangeably in this lecture. Glucose by nature is of fuel. That is to say, its principal mission is to burn itself to provide energy for biological activity of the body. Pay special attention to its nature as a fuel. It is a fuel, ladies and gentlemen, exactly like gasoline to a car. How can you neglect oxygen when you consider about a fuel? Unless there is sufficient oxygen always available right there. But as I concluded in previous sections, hypoxia is permeated in modern human life. What if the body falls into hypoxia as seen made by poor RBC quality? I believe you remember the 5 factors of RBC that influence oxygen delivery efficiency of the blood. Without a question, hypoxia must cause disorders to glucose metabolism. However, now in clinical practice worldwide, hypoxia is almost totally neglected while treating obesity and diabetes. If you are one of the patients, have you ever heard your doctor talking about hypoxia? Isn't it a serious blunder? Okay, let's see in detail on this subject. I believe everyone knows about this hormone, insulin, without which cells are hard to take up glucose. Therefore, insulin plays the pivotal role in glucose metabolism. The general rule is the more insulin is out there, the more quickly a cell takes up glucose from blood. Accordingly, the faster the sugar level comes down in the blood. The factors that are influential to glucose metabolism can do so by affecting secretion of insulin. So question is, how hypoxia affects the secretion of insulin? My proposition is that hypoxia stimulates or promotes insulin secretion. I have two evidences supporting my proposition. According to a paper by R.C. Soni et al., when people move from sea level to high altitude of 3,000 meters above sea, insulin level elevates markedly. For your information, oxygen content of the air at 3,000 meters above sea is approximately 30% less than that in sea level. It means when you come to high altitude area, your blood carries less amount of oxygen. Accordingly, all the tissue cells across your body are difficult to acquire oxygen as much as needed. It is an experimental evidence that tells hypoxia stimulates secretion of insulin. Next is theoretical evidence that is more convincing. Under hypoxia, cells suffer from energy deficit. In response, cells are intrinsically going to do everything to fill up the energy gap. The alternative is glycolysis. It is the fermentation of glucose, where without oxygen, 1 molecule of glucose contributes 2 units of bioenergy. In comparison, though, the identical 1 molecule of glucose contributes 38 units of bioenergy under sufficient oxygen supply. That is 19 times without oxygen. Do the math. Assume in a given moment, a cell needs 380 units of bioenergy. It takes only 10 molecules of glucose fully oxidized to do the job. However, in case there is a 10% of oxygen shortage, to produce the same 380 units of bioenergy, it takes 28 molecules of glucose, 9 fully oxidized, and the extra 19 by glycolysis without oxygen. See, 10 glucose molecules over 28. That's net increase of 190% in glucose requirement. In other words, under hypoxia, cells have voracious appetite for glucose in order to fill up the energy gap. How to help cells in hypoxia take up vastly increased demand of glucose? The answer? Definitely high level of insulin. Therefore, by design, it is a mandatory requirement that hypoxia stimulate insulin secretion. Unfortunately, most researches on this subject are mainly without consideration of hypoxia, which is really unthinkable. Keep it in mind, it is hypoxia that requires high insulin level to solve energy deficit, other than so-called insulin resistance that induces high insulin level. Here I have a word on the concept of insulin resistance, which is quite popular among professionals. Weird enough, this concept is absolutely not useful in treating obesity and diabetes in practice. To me, its one and only role is to give professionals an easy tool to explain with the least effort, seemingly plausible, the formation of obesity and diabetes. By consensus, insulin resistance means cells become less efficient in taking up glucose under the same insulin level. Since I observed that improved oxygen delivery of the blood is very effective to most obesity and diabetes, I propose that so-called insulin resistance is probably caused by hypoxia through increasing viscosity or stickiness of the cytoplasm of tissue cells, as viscosity lowers the entering speed of glucose. Under hypoxia, insulin level elevates, which in turn helps cells take up increased number of glucose, many of which end up in metabolic intermediaries due to oxygen shortage, other than water and carbon dioxide. With the accumulation of these water-soluble metabolic intermediaries in cytoplasm, intracellular fluid becomes sticky because the more number of water-soluble molecules, the more sticky is the cytoplasm. Uptake of glucose is of diffusion. Keep it in mind, according to diffusion law, the more sticky is the cytoplasm, the more slow is the speed of glucose diffusion. Since glucose enters with a low speed, cells are naturally less efficient in taking up the glucose. Obesity is in essence a result of fat cells storing too much fat. By design, fat cells are better in uptake of glucose than most other cell types under hypoxia due to two advantages. One, it has second most dense distribution of insulin receptors in the surface of their membrane, second only to liver cells. That means fat cells have a more chance utilizing insulin to take up more glucose than most other cells. Two, fat cells use glucose to make fat. That means most glucose molecules absorbed are not ending up in metabolic intermediaries, instead transformed to fat, which can reduce the number of water-soluble metabolic intermediaries in cytoplasm of fat cells, which is obviously good for maintaining lower viscosity. And a lower viscosity is a plus for quick uptake of glucose. Surely, the more glucose uptake, the more fat is made, and the result is obesity. Anyway, my opinion is that a so-called insulin resistance has nothing to do with the insulin itself, and it's totally useless. Okay, so much for insulin resistance. Let's back to right track. There is a consensus among professionals that a sustained high level of insulin, or hyperinsulinemia, always accompanies obesity. That's reasonable because high insulin level accelerates uptake of glucose by fat cells, which results in obesity. So identifying those factors that influence the secretion of insulin is the key to the formation of obesity. First, hypoxia. As I just explained, hypoxia stimulates insulin secretion, therefore increases insulin level, which over time causes obesity. We can observe that obese people usually shows hypoxic manifestations such as less energetic, sleepiness, and so on. Therefore, hypoxia is an important reason for the formation of obesity. Second, incretin, a hormone secreted by small intestine, is another factor that stimulates insulin secretion. Therefore, it increases the insulin level, which is obviously a plus for formation of obesity. The persuasive example is probably the case of a gastric bypass surgery, which is reported to be effective in weight management. The surgery excises significant length of a small intestine, which in my opinion unknowingly lowers incretin secretion, because the excised length of a small intestine contains many cells that are capable of secreting incretin. Accordingly, incretin secretion decreases, which translates into reduced insulin level. And a low level of insulin is surely effective for weight management. The interesting part is the surgery by design is not reducing the number of incretin secreting cells. The original objective of the surgery was to lower the absorption capability of a digestive tract by means of excising certain length of a small intestine. However, my point is that without lowering insulin level, any means of weight management wouldn't work at all. Think about it. If the insulin level remains high, the glucose uptake by tissue cells remains high too. Therefore, the hypoglycemia is inevitable shortly after each meal. Hypoglycemia means low-level glucose in blood, which induces strong sensation of hunger. And you have to eat a whole lot again, no matter how is the absorption capability of your digestive tract. See, those obese people, they have a voracious appetite for food, which is the result of a hypoglycemia, which in turn is caused by high level of insulin. Therefore, for weight management, manipulation of insulin level is the ultimate key, not the absorptive capability of a digestive tract. By the way, so far, it is not clear how incretin is regulated. Thirdly, epinephrine, or adrenaline, secreted by adrenal glands, inhibits insulin secretion, lowering insulin level, which causes thinness. High level of epinephrine brings about several other manifestations, such as short temper, hyperactivity, insomnia, etc. If you are good on observation, you will find none of these traits is connected to obese people, which implicates that obese people are low in epinephrine. In fact, if anyone is high in epinephrine, they are off from obesity, because high level of epinephrine inhibits emergence of a high insulin level, which is a precondition for the formation of obesity. This is a very important point. Keep it in mind. High level of insulin, which causes obesity, is incompatible with a high level of epinephrine. Meanwhile, epinephrine stimulates fat cells to release fat reserve, which is obviously good for weight management. Therefore, certain level of epinephrine is a must condition for proper weight management. Ephedrine, an extract from yellow hemp, has a similar medical efficacy with epinephrine, also able to inhibit insulin secretion as well. It was once a hard sell item for weight management dozens of years ago in America, and banned at the end due to the fact that, like epinephrine, abuse of it induces cardiovascular problems. Okay, to sum up, the formation of obesity requires high-level insulin, which in turn is caused by hypoxia, normal or high level of incretin presumably, and a low level of epinephrine. Now let's turn to the topic of the formation of diabetes. By definition, diabetes is the situation where sugar level maintains at a higher than normal level. Take a look at this diagram. In this diagram, hormone in red ink means it inhibits its target cells. See, only epinephrine here inhibits insulin secretion. Other hormones are all in black ink, which means they stimulate target cells. For regulation of glucose in blood, there are always two sides in work: the side of glucose uptake by tissue cells and the side of glucose supply, mainly by the liver. We should be very clear that while the speed of glucose supply exceeds the speed of glucose uptake, sugar level is doomed to elevate, and the formation of diabetes is unavoidable. The speed of glucose uptake is decided by the insulin level, which just like we have discussed a minute ago, that three factors work on in concert. What about the speed of glucose supply? Similarly, it is decided by levels of two hormones, epinephrine and glucagon. The higher the level of either of the two, the more quickly liver supplies glucose to the blood. Obviously, to achieve the diabetes, where glucose supply exceeds glucose uptake, there are only two scenarios. One, low-speed glucose uptake combined with high-speed glucose supply. The other scenario, high-speed glucose uptake combined with much higher glucose supply. Let me start with the latter, which exactly coincides with the most prevalent type of diabetes, type 2, and I give you perfect explanation in light of hypoxia. First, high-speed glucose uptake, which requires a high level of insulin. Type 2 diabetes is preceded by obesity, which is caused by high insulin level, as we concluded a few minutes ago. And high insulin level causes high speed of glucose uptake. And high insulin level is caused mainly by hypoxia and low-level epinephrine, as we concluded while we discussed the formation of obesity. Type 2 diabetes are also characterized by susceptibility to hunger and hypertension. High level of insulin helps the tissue cells take up glucose quickly, causing shortly after each meal hypoglycemia, which induces strong sensation of hunger. Severe hypoxia is also able to cause high blood pressure, mechanism of which has been discussed in previous section. See, everything is caused by hypoxia in case of obesity and type 2 diabetes. What about the other side, higher speed glucose supply, which involves liver releasing glucose at a much higher speed to the blood? By analogy, liver is like the oil tank of a car, and the glucose like oil. After each meal, liver builds up a glucose reserve, which is like filling up the oil tank. Like an oil tank supplies oil to the engine, the liver releases a glucose reserve to replenish the blood of sugar, which is continuously consumed by tissue cells across the body. Pay attention to the fact that obese people or type 2 diabetes are susceptible to falling strong sensation of hunger shortly after each meal. Strong sensation of hunger implicates low glucose level or hypoglycemia. Keep it in mind, if liver maintains glucose reserve, there is no hypoglycemia, because the liver is obliged to supply glucose to the blood as long as the reserve is available. In other words, hypoglycemia is a result of the liver depleted of its glucose reserve. So we can conclude with obese people or type 2 diabetes patients, liver is supplying the glucose too quickly to be depleted of glucose reserve within short time. That's exactly the reason why hypoglycemia and a strong sensation of hunger turns up shortly after each meal. See, this is the manifestation of a high-speed glucose supply by the liver, which is only possible under high level of a glucagon or high level of epinephrine. But while we discussed the formation of obesity a few minutes ago, we concluded that obesity is impossible to have a high level of epinephrine. Therefore, the only possibility on table is a high level of a glucagon, which stimulates the liver to quickly release glucose reserve. Here, I have to make a proposition. That is, hypoxia may stimulate glucagon secretion by islet A cells, which are responsible for synthesis and release of glucagon. Okay, let's summarize to have a clear picture. Under hypoxia, on one hand, insulin level is high, which promotes the speed of glucose uptake and causes obesity. On the other hand, under hypoxia, glucagon level is also high, which stimulates the liver to release glucose quickly. But so far, the side of glucose uptake and glucose supply are in balance, both at a high speed, maintaining normal level of glucose. Therefore, up until now, there is only formation of obesity, no diabetes yet. How can the side of glucose supply gain upper hand over the side of glucose uptake to give rise to diabetes? We can find the answer still in hypoxia. Hypoxia over time causes the death of islet B cells, which is responsible for insulin synthesis and release, because B cells are, by design, very susceptible to hypoxia. As a result, insulin secretion tapers off under sustained hypoxia over time. On the other hand, glucagon secretion by islet A cells is not compromised by hypoxia, because not like B cells, A cells don't die. See, over time, insulin secretion tapers off due to the continuous demise of B cells, which means the speed of glucose uptake is progressively compromised, while the glucagon secretion remains strong, which means the speed of glucose supply remains high. This situation must evolve into diabetes over time. Now, we can clearly see type 2 diabetes is possible only after significant number of B cells die away, which certainly takes quite a time. That's why obesity always precedes type 2 diabetes. Assume islet B cells don't die under hypoxia condition, then there will be only obesity, no diabetes at all. Mind you, at the beginning stage of diabetes, patients are still higher in insulin level than the normal people, but the glucagon level is much higher. And it is predictable that at the advanced stage, when the number of surviving B cells is too low, the insulin level may dip less than that of normal people. Then one is to become thinner day by day, but glucose level becomes more difficult to control. Now let's turn to second scenario, where the speed of glucose uptake is low and the speed of glucose supply is high. Although type 1 diabetes belongs to this scenario as well, which is saved of discussion in this lecture. What I'm talking about is a novel type of diabetes characterized by high level of epinephrine. In the past 11 years, I observed that one type of diabetes is quite prevalent, but it seems not covered medically. This type of diabetes are characterized by short temper, not necessarily young of age, normal blood pressure, getting thinner day by day upon initiation of the diabetes. Many of them got the diabetes after emotional trauma, which implicates probably there is an issue of a microcirculation disturbance in certain region of the brain. For the mechanism causing microcirculation disturbance, you may watch previous section. Before initiation of this type of diabetes, one may be obese, but upon onset, one gets thinner day by day. Again, take a look at this diagram. Thinning is an important sign that implicates the patients are low in insulin, which means the speed of glucose uptake is slow. See, this type of diabetes is slow in glucose uptake. Let's see how the three factors that are influential to insulin secretion work to maintain low level of insulin. Epinephrine is the only hormone that inhibits insulin secretion. Therefore, the high level of epinephrine is a must for the possibility of a low level of insulin. I said this type of diabetes patients are in short temper. That is exactly characteristic manifestation of a high level of epinephrine. To achieve a low level of insulin, there wouldn't be hypoxia, because hypoxia stimulates insulin secretion. Yes, sure. Epinephrine is a potent agent for increasing RBC flexibility, which improves oxygen delivery efficiency of the blood. Therefore, hypoxia is off the table under high level of epinephrine. Good oxygen delivery efficiency of blood is helpful to maintain a normal blood pressure as long as the level of epinephrine is moderately high, because extremely high epinephrine is likely to cause diastolic hypertension by excessively constricting peripheral vessels, as observed in the scenario of a chromatin tumor, which secretes extremely high level of epinephrine and also single-handedly induces diabetes as well. What about the incretin, which also stimulates insulin? I'm not sure how is the incretin secretion, but I suppose incretin level should be normal or low. See, moderately high level of epinephrine is good enough to induce many changes, such as low speed of glucose uptake by lowering insulin level, thinning, a short temper, and a normal blood pressure. What about the speed of glucose supply? Epinephrine is a potent agent to stimulate the liver to release glucose reserve. Epinephrine also stimulates islet A cells to secrete glucagon, which in turn stimulates the liver to release glucose reserve. Epinephrine also stimulates fat cells release fat reserve to provide raw material for glucose synthesis at the liver. Therefore, moderately high level of epinephrine is strong enough to boost glucose supply to high speed. See, low speed of glucose uptake combined with high speed of glucose supply. The result is surely diabetes. This type of diabetes is in a sense result of a high level of epinephrine, which is likely caused by microcirculation disturbance in either hypothalamus, which regulates secretion of epinephrine, or adrenal gland, which are responsible for synthesis and release of epinephrine. I coined this type of diabetes epinephrine-rich diabetes. Okay, now what about the solutions? I observed the method of OTEC is very effective with the obesity and type 2 diabetes patients, as they are purely caused by hypoxia. Once they regain being energetic, which implicates good oxygen supply across the body, their overall health conditions, including the sugar level and the complications, improves significantly. The improvement can be felt in person very vividly. For more information, you may visit my website here, zhuchengtai.net. For epinephrine-rich diabetes, the solution to microcirculation disturbance is supposedly useful, which was described in previous section of a formation of a microcirculation disturbance. It is expected that a healing crisis is likely to occur at the beginning stage with this type of diabetes, which means temporary rise in sugar level, and you need an insulin injection to control the glucose. Okay, so much for obesity and diabetes. Let's move on to the next section, hypoxia on brain problems. By design, brain is most strictly protected. Besides the solid protection by the skull, it is also protected by a unique mechanism called brain-blood barrier. Simply speaking, it prevents any microbial agent from harming the brain as much as possible. Therefore, brain is seldom disturbed by microbial infection. On the other hand, brain consumes more than 20% of the total oxygen consumption of the body, and the brain is most vulnerable to hypoxia. And by design, it is equipped with whole mechanisms for being supplied of oxygen on demand basis, which means no matter how much oxygen is demanded, no matter when, the cardiovascular center is instantly in action to meet the oxygen requirement of the brain, at least to the most important brain tissues. Sure, it is by design. I mean, in reality, it can be in trouble. Just like I told you before, that hypoxia exists everywhere in modern human life, either purely made by inferiority of the RBC quality or by microcirculation disturbance. Emotional and psychological trauma or overload of stress is accompanied by sudden surge of oxygen consumption. Therefore, the arterioles supplying the concerned nucleus is susceptible to ending up in permanent microcirculation disturbance, especially when RBC quality is inferior. By the way, in neurology, any independently functioning unit of a brain tissue is called a nucleus. Keep it in mind, under hypoxia, any nucleus presumably suffers, resulting in disorder, mild, moderate, or severe, depending on the degree of a hypoxia severity. However, if you look around, you will find two things that are weird. One, no one bothers to treat any of the prevalent brain disorders in light of hypoxia, such as depression, anxiety disorder, mental fatigue, irritability, obsessive compulsive disorder, and so on. Two, all these brain disorders are unknown of a concrete cause. What doctors do now is merely treatment to the symptoms, temporarily relieving the patient of symptoms. These facts bring up the issue I repeatedly talking about. Hypoxia is widely neglected. Consequently, any disease caused by the neglected hypoxia is incurable, and the brain is especially susceptible to hypoxia. According to my observation, OTEC is very effective to a variety of brain problems. For more information, you may visit my website here, zhuchengtai.net. Okay, let's move on to next section, hypoxia on kidney malfunction. Poor RBC quality causes whole body hypoxic. With hypoxia, every cell across the body is to generate plenty of metabolic intermediaries, which eject the cells and get into the bloodstream ceaselessly. Since these metabolic intermediaries still hold the valuable nutrition, they will be reabsorbed in kidneys. The work of reabsorption surely consumes energy. Therefore, without rest, they put ever-increasing workload to kidneys because they continuously undergo reabsorption process in kidneys as long as they circulate. It is obvious the more severe the hypoxia, the more quantity of metabolic intermediaries are generated from almost every cell across the body. These metabolic intermediaries ceaselessly bombard the kidneys by increasing the workload of reabsorption. On the other hand, kidneys themselves suffer from hypoxia as well under poor RBC quality. Mind you, kidneys consume more than 10% of total oxygen consumption of the body. Therefore, mere tight oxygen supply itself put kidneys in difficult situation. What's more, ever-increasing number of metabolic intermediaries ceaselessly rush in to relentlessly increase the workload. This scenario is very likely to cause microcirculation disturbance in kidneys. As I explained in previous sections, the two factors work together to cause microcirculation disturbance. One, poor RBC quality. The other, increased oxygen consumption. Obviously, the problems above can be solved for good only by improving RBC quality. However, in clinical practice, no solutions have anything to do with RBC. For example, two commonly used solutions, kidney dialysis and kidney transplant, have nothing to do with RBC quality, which means underlying problems still remaining unsolved. Therefore, both of them can only deliver temporary improvement in renal function, with the kidney dialysis effective less than a week, and the kidney transplant effective several years. Therefore, both of these solutions is not a good choice. OTEC is the only best choice. For more information, you may visit my website here. Okay, we move on to next section, hypoxia on liver malfunction. First, liver accounts for more than 20% of total oxygen consumption of the body. So it is obvious that hypoxia is harmful for liver to function well. Second, hypoxia induces a high level of insulin as described previously, which in a sense hijacks the liver take up glucose at a high speed, building up a glucose reserve. Hypoxia also induces a high level of glucagon, which depletes the liver of a glucose reserve in short time, exactly opposing the role of a high-level insulin. This process is obviously adding tremendous burden to liver. Meanwhile, at a high insulin level, liver may take up too much glucose, part of which has to be transformed to fat, which accumulates to form fatty liver. Thirdly, hypoxia causes the generation of a huge amount of metabolic intermediaries across the body, part of which end up entering the liver to produce glucose, which in turn is released to blood again. This is extra burden to liver. Think about it. If sufficient oxygen is supplied at the first place, the biofuels like glucose and fat are fully oxidized to turn out water and carbon dioxide. Then there won't be any metabolic intermediaries produced, and neither this extra pathway of metabolic intermediaries across the body returning to liver for reassembled into glucose again. Anyway, maintaining best quality of RBC is vital to good shape of liver function, and OTEC is the best choice for RBC improvement. Okay, let's move on to the next section, hypoxia on immunity. First, hypoxia induces death of cells called apoptosis. The corpses of the cells, so to speak, or debris of the cells, are cleaned up by phagocytes, the important member of an immune system. Imagine about it. Under long-lasting bodily hypoxia, which can be brought about by poor RBC quality, there are plenty of cell deaths arising every minute, and the phagocytes are called in to clean up the debris. Cell deaths induced by hypoxia is obviously a waste of bioresources, and the phagocytes cleaning up the dead cells are the waste of or exhaustive to immune reserve. What's more, phagocytes die upon completion of their job of cleaning the site. For a valid immunity, one should have a bumper reserve of immune resources always ready to defend against invading pathogens. Obviously, hypoxia weakens one's immunity by wasting immune reserve, just like explained above. Second, hypoxia makes the liver less functional, just like I explained at the previous section. Liver is an important organ that synthesizes most of the members of a complement system, which is indispensable arm of the immune system. With the liver struggling to barely synthesize complement members, one's immunity is severely compromised, especially under intense attack by pathogens. Thirdly, I want to talk about adaptive immune reactions, where immune system can eradicate pathogens with a high efficiency. I observed several cases of adaptive immune reactions on users of exosoftgel in the past 11 years. All of them were frail, implicating brimming number of pathogens inside the body. These observations lead me to think that triggering of adaptive immune reactions requires at least two conditions. One, increased oxygen delivery. The other, significant number of pathogens inside the body. Adaptive immune responses share following manifestations: lazy, sleepy, feeling cold, fever with a body temperature lower than 38.5 degrees Celsius. Phlegm can be felt deep behind the sternum because when you cough, you will unknowingly put one hand on the place where your sternum resides. Time it takes to complete the reaction is in the range of several hours to 3 days or more. Upon initiation of adaptive immune reactions, all you need to do is taking full rest and full sleep. Don't try to bring down the fever as long as the temperature is under 38.5 degrees Celsius. In the course of adaptive immune reactions, immune system may commandeer most bioresources of the body. That's why you feel lazy and sleepy. And at the high temperature, immune system is supposed to work with a better efficiency. That's why there's always fever arising in any kind of immune reactions. But the temperature should be less than 39 degrees Celsius. Otherwise, it is harmful to the lungs. Okay, so much for the immunity. Let's move on to the last section of this lecture, hypoxia on insomnia or sleeping disorder. This subject is more of empirical than theoretical. I found in the past 11 years that OTEC is very effective to insomnia. OTEC is equal to simply taking exosoftgel while one is fully equipped with all the nutrition necessary for normal maturation of RBCs. Although in clinical practice, insomnia is grouped into complex categories, empirically, I observed that distinctively different two types can cover most insomnia cases. Type 1. Upon taking exosoftgel, the patient can enjoy very good quality sleeping. To explain this observation, I have to resort to theories of a traditional Chinese medicine, which states weakness in any of such organs as spleen, liver, and kidney causes insomnia. Exosoftazole, by improving oxygen delivery, is good to all these three organs. That may explain why exosoftazole is very effective to most insomnia cases. Type 2, upon taking exosoftazole, one is more sober or clear-headed than usual. The symptom is probably similar to the effect of taking caffeine. Sure, it can be interpreted as a healing crisis. And this type of insomnia can be cured by method I designed for solving microcirculation disturbance. To be specific, 7 days at a time, taking 6 pills of exosoftazole at a time, plus normal serving size of ginkgo leaf extract. With the second type of insomnia, I suppose there is a microcirculation disturbance with a particular nucleus which upon stimulation may bring soberness to brain. With a large dose of exosoftazole plus a vasodilating agent like a ginkgo leaf extract, the microcirculation disturbance is solved better each time of administration, and the insomnia itself improves time by time. For more information, you may visit my website here, zhuchengtai.net. That's all for my lecture on hypoxia. I hope this lecture may open the closed eyes on hypoxia in medical world and help more people enjoy better life quality by getting rid of most of the presently prevalent chronic diseases. Thank you for your watching.